Welcome to Chapter 20, Care of Patients with Coronary Artery Disease and Cardiac Surgery. We're going to take a quick overview. Our theory objectives: discuss the causes of coronary artery disease, describe the pathophysiology of coronary artery disease, outline nursing interventions to care for a patient experiencing angina, including medication administration and patient teaching, and discuss the pathophysiology of MI, or myocardial infarction. As well, we want to compare and contrast the symptoms and care for unstable angina and compare those to those with MI. Develop a nursing care plan for a patient with MI and describe the nursing care of a patient undergoing cardiac surgery. We want to be able to list 5 complications of cardiac surgery. In terms of clinical practice objectives, we want to develop a teaching plan for patients with coronary artery disease, or CAD, identify signs and symptoms that indicate a patient may be experiencing an MI, administer medications to patients experiencing cardiac disorders, collaborate with other healthcare providers to care for patients after cardiac surgery, and contribute to discharge planning for a patient after cardiac surgery. In terms of CAD, looking at the etiology, cultural considerations, and pathophysiology, we do take into consideration coronary insufficiency and cardiac reserve in older adults. We'll take a look at signs and symptoms of CAD a little later in the program, including acute coronary syndrome, as well as diagnosis, treatment, complementary, and alternative therapies. Progression of atherosclerosis. This figure is figure 20-1 on page 452. Please be aware of it. Signs and symptoms of coronary artery disease include chest discomfort, including feeling of tightness, aching, and burning, chest pain, or otherwise known as angina pectoris, radiating to the arm, jaw, or back, dyspnea or shortness of breath, palpitations or tachycardia, nausea, and vomiting. As well, cold, clammy skin, undue fatigue, particularly in women, weakness and inability to complete usual activities without chest pain, or dyspnea. We want to note that box 20-1 on page 452 expounds on these. In terms of nursing management, very often aspirin, either 81 milligram or 325 milligrams, are prescribed to prevent MI. Lower fat and cholesterol in the diet is also encouraged. Let's look at an audience response question. After reviewing risk factors for cardiac disease, the patient is prescribed atorvastatin or Lipitor to reduce cholesterol levels. The nurse must include which instructions? Select all that apply. Report any muscle weakness, avoid exposure to sunlight, schedule for renal function test, do not drink grapefruit juice, maintain a low protein diet. The correct answers are number 1, 2, and 4. Angina pectoris. Let's look at this a little closer. Angina is chest pain caused by decreased blood supply or obstruction to the heart muscle itself. There are 3 kinds that we wish to expound on. The signs and symptoms of stable or exertional angina: it's triggered by physical activity or stress and related to atherosclerosis. The goal of therapy is to reduce intensity and frequency of attacks. Variant or vasospastic angina is caused by coronary artery spasms, which restrict the blood flow to the myocardium. The goal of that treatment is as well to reduce the number and severity of attacks. We also have unstable angina, and this is usually caused by occlusion of the coronary arteries. Angina pain occurs even at rest in this case and may not respond well to drug therapy. It may require immediate surgery. We also look at diagnosis of this and how they do that. Treatment, usually with ASA 81 or 325 milligrams for decreased platelet aggregation, also Plavix and antiplatelet, and in both of those cases we want to watch for bleeding. The most common drug for angina is nitroglycerin sublingually, and that needs to be kept in a cool, dark place. I'd also like you to note critical thinking questions on page 456 in the textbook. This photograph shows stenosis of the left anterior descending coronary artery, and you can see the blockage there. It is on page 454, figure 20-2 in your textbook. Acute myocardial infarction, or MI, its etiology and pathophysiology. In an MI, the heart muscle has an area that dies. It's necrotic tissue, and this tissue cannot contract normally. We talked about some of the signs and symptoms before of heart pain. Also for the MI, women tend to present with atypical symptoms, sharp pain or fatigue or weakness. Older adults tend not to complain of signs and symptoms, but rather are talking about indigestion, nausea, dyspnea, and confusion. The diagnosis is made by electrocardiography, cardiac enzymes, cardiac catheterization, and angiography. In the cardiac catheterization, if there are no complications, at present the protocol is that most people can be up walking in 2 to 4 hours after a cardiac cath. Other treatment is done by the acronym MONA: morphine, oxygen, nitroglycerin, and aspirin. The second audience response question: immediate therapeutic measures given to a patient with an acute MI include, and this is another select all that apply, morphine sulfate, oxygen therapy, furosemide, nitroglycerin, aspirin. The answers that are correct are 1, 2, 4, and 5. Tests we perform to determine MI: troponin. We have the troponin I and the troponin T. Normal levels of those are for TNI are 0.3 micrograms per liter, and that's actually less than. And then for TNT, it's less than 0.1 micrograms per liter. Creatinine phosphokinase can be different than normal, but it's also noted to be that way with any kind of muscle injury, not just heart muscle. CKMB normal is less than 3 nanograms per milliliter, and then myoglobin has changes as well. These are all differentiated in table 20-2 on page 458. The Joint Commission has issued core measures for MI, and those include aspirin administered within 24 hours of arrival at the hospital or within 24 hours before arrival, beta blocker started within 24 hours of arrival, thrombolytic agent administered within 30 minutes of hospital arrival, and they describe that it is preferred within the first 6 hours after symptoms, but can be given up to 12 hours after offset of signs and symptoms. It is contraindicated in patients with uncontrolled hypertension. And then aspirin therapy at discharge, beta blocker therapy continued at discharge, ACE inhibitor at discharge for left ventricular ejection fraction of less than 40%, and then patients with a history of cigarette use within the past year are giving smoking cessation advice or counseling during their hospitalization. You can see further information on this, box 20-2 on page 454. Again, treatment is by MONA regimen, oxygen, sublingual nitroglycerin, morphine sulfate, and for that we need to watch for decreased respirations, thrombolytic agents, pacemaker, temporary pacemaker may be placed if persistent bradycardia or complete block is in place. There are different ways to take care of acute care, critical care, and intermediate care. And then there is cardiac rehabilitation, which will focus on dietary changes, stress reduction, and exercise. Acute coronary syndrome, or ACS, the nursing management includes pain relief, rest, medications, and knowledge of side effects, frequent cardiovascular assessment, weight and intake output, vascular access, activity, decreasing anxiety, and again, cardiac rehab. Signs and symptoms of complications of MI include dysrhythmias, heart failure, cardiogenic shock, which we will touch on a bit more, papillary muscle dysfunction, ventricular aneurysm, pericarditis, which would be noted by a friction rub, and Dressler syndrome. You can see more about that, table 20-3 on page 460. Emotional and behavior responses to acute MI include denial, anger, anxiety and fear, dependency, depression, and that seems to be a huge one. So make sure you use your therapeutic communication. And then finally, realistic acceptance. See box 20-3 on page 462. Cardiogenic shock in signs and symptoms include confusion, restlessness, diaphoresis, rapid thready pulse, increased respiratory rate, cold clammy skin, and diminishing urinary output to less than 20 mils per hour. If you notice these signs and symptoms, make sure you get a provider quickly. Also, we note decreased cardiac output. The intra-aortic balloon pump, or IABP, they use a balloon catheter positioned in the aorta that inflates during diastole and deflates during systole, effectively decreasing the workload of the heart and increasing blood flow through the coronary arteries. Surgical and non-surgical treatment options include percutaneous transluminal coronary angioplasty, PTCA, proton pump inhibitors, transmyocardial laser revascularization, and then two types of cardiac surgery that are common: coronary artery bypass surgery, or CABG, which stands for graft, or heart transplant. Nursing care of the patient having cardiac surgery includes preoperative care, which includes diagnostic tests and exams, a lot of teaching, and then psychological preparation. And then post-operative care, early post-operative period and critical care, frequent assessment of respiratory and cardiac status, care of invasive lines and chest tubes, wound assessment and care, fluid and electrolyte balance, pain management, and assessment of emotional status. Audience response question 3. Immediate post-op nursing care of a patient who has undergone open heart surgery includes: select all that apply, assess cardiac rate and rhythm, check chest tubes for drainage, monitor liver enzymes, assess bowel sounds, manage pain. Correct answers are 1, 2, and 5. Again, for cardiac rehab, we're talking about mainly exercise, diet, and stress reduction. The home recovery period is taken into consideration. Dressler syndrome, depression, preventing infection, and monitoring for complications are all very important. Once a person has recovered and are back into the community, we want to make sure they restore and maintain their optimal physiological function, improve their psychological outlook, and maintain their ability to work and have social well-being. Make sure that you note the key points listed in the review on page 469 of your textbook.